Does the BCG vaccine prevent latent TB infection? Imagine a shot that can help protect you from a hidden form of tuberculosis, but not completely. That's what the BCG vaccine does. It is designed to help prevent tuberculosis, especially in children, but its role in stopping latent infections is more nuanced. The BCG vaccine offers significant protection against latent tuberculosis infection, but it is not fully protective. It can lower the chances of developing a hidden infection after exposure to the bacteria. Studies in children who migrated from high TB areas show that those with a BCG scar had about a 59% lower chance of having latent TB compared to unvaccinated children. This suggests that BCG can help reduce the risk of getting infected with the bacteria that cause TB. How does it work? The vaccine stimulates the immune system to respond more effectively. It trains the innate immune cells to react faster and stronger when they encounter the bacteria. This trained immunity can help the body clear the bacteria early, which means fewer people develop a latent infection. However, BCG is most effective in preventing severe forms of TB in children, like TB meningitis and widespread disease. Its protection against pulmonary TB, which is the most common form in adults, is less consistent and tends to vary. It does not reliably prevent all latent infections or stop the bacteria from becoming active later on. Another important point is that BCG vaccination can cause false positive results on the tuberculin skin test. This can make it harder to tell if someone has a latent infection, especially if they received multiple doses or were vaccinated after infancy. In many countries with low TB rates, BCG is mainly given to high-risk groups, such as children exposed to untreated TB or healthcare workers in high-risk settings. It is not routinely used in adults or populations with low exposure risk. In summary, the BCG vaccine does help reduce the risk of latent TB infection, but it does not completely prevent it. It is most useful for protecting children from severe TB forms and is part of broader TB control efforts. Because it does not eliminate the risk of latent infection, health authorities also recommend screening for latent TB and providing preventive treatment when needed. Always remember, for personalized advice and the best protection, consult healthcare professionals. They can help determine the most appropriate strategies based on individual risk factors and local disease patterns.